Hey everybody, this is Shayna Thomas Vlogs. So it has been a while since I've actually sat down with you guys and talked to you guys. You guys are sitting up at an angle. Well, you're sitting up higher, and then I have you tilted down so I can see you guys a little bit better. So if you have any questions about what I'm talking about, you can leave them down in the chat. I'll wait for a few people to hop in. But I will say this that what I'm about to talk is really serious. It is made for kids, but at the same time, I didn't want to make it for kids, so that is why. So I have some pamphlets here that I am going to read. I haven't went through all of it because it's a heavy load of pamphlets. It's two big pamphlets put together that I basically got off of the internet, and I've researched each segment that I'm going to talk to you guys about today. So, I am living and dealing with a condition called degeneration. Degenerative disc disease. Basically, what I've heard uh, is that Asians tend to get it for some odd reason. Asians get this disease. Um, and I'm just gonna read. I'm not gonna read the whole thing to you because it's just a very lengthy thing. I don't want to be on here for 2-3 hours, maybe an hour. I know it's gonna take more than 30 minutes to do. So I'm reading this right off of the thing. If you want this, I can kind of tell you where to get this. If you just look up what this is, you'll understand. So right now, let me go back about 3.5 years ago. I was really, really just taking care of my mom. She had diabetes. She had kidney failure. She had type 2 diabetes. She had all these things going on with her. And I was taking care of her, um, and my brother. But I was pretty much. I think what really caused it is over time having to push her in a wheelchair and having to, it really causes it to stress. Is stress related as well. But it is something that I wish not even my worst enemy would have it. Because honestly, it is that bad that I literally wish that my worst enemy wouldn't have it. So I'm gonna make sure this is going well because I feel like I don't have like the greatest lighting. I going well because I feel like okay. I see myself, but I don't know if it will not show me that I'm on because of all of it. But anyway, so I just wanted to make sure I was able to hear, and so um, so degenerative disc disease, also known as DDD, and I'll say that more because degenerative disc disease just is so long. So DDD, and it is when normal changes that take place in discs if your spine uh, because of your spine, it could cause pain. So spinal discs are shock absorbers. So if you all mechanics out there know, you have shocks and you have shock absorbers. Okay, your absorbers are between your vertebrae and your bones of your spine. They help your back stay flexible so you can bend and twist. As you get older, they can show signs of wear and tear, and they begin to break down and may not work as well. And this is just, like I said, I'm reading this right off of the sheet that I have in front of me. Nearly everyone's discs break down over time, but not everyone feels pain. If worn out, spinal discs are reason you're hurting. You have DDD, degenerative disc disease. Um, and they actually spelled disc wrong. It's DIC, or I'm sorry, yeah, disc, like a disc. So, what causes it? So your spinal discs are made of soft inter inner core and a tough outer wall. The discs change in ways that may cause DDD, such as dry out. So you can have this your discs, your spinal discs be dried out. When when you are born, the discs in your spines are mostly made up of water. As you age, they lose water and get thinner. Flatter discs can't absorb shocks as well. The water loss also means less cushion or padding between your vertebrae. This can also lead to other problems in your spine that may cause pain. Okay, and we'll talk about also like how to get rid of it, what are the options, and we'll get to that actually here in the next page. Okay, crack. You can also have a crack. So so the stress of everyday movements are minor. They are minor, and they're minor injuries. Over the years, they can cause tiny tears in the outer wall, which contains nerves. Any tears near the nerves can become painful, and if the wall breaks down, the disc's soft core may push through the cracks. The disc may bulge or slip out of place, which is called a slipped disc, or a herniated disc. It could affect the nearby nerves, which that's not me. It's more of a muscle thing, and I get more of a spasm. And I believe I have the first one, which is the drying out. But I could have both. I really don't know. So, what are the symptoms? Well, you can feel a sharp or constant pain. So it's like someone poking you, but really, really like aggressive poking. Okay. It looks like there's like a big eye. I just realized that when I looked up. There's a clock there, but it looks like there's like a big. Can anybody see that, or is it just me? It's like a big eyeball. I'm weird now. I'm weirded out now. Anyway, so it could cause uh sharp sharp or constant pain in your back and neck. Now I do have it up on the upper top of my neck, and that I might have to have 2 surgeries for. I don't know if I'm gonna really have surgery or not. We'll just see. We'll see what happens. I go see the doctor next Friday. So um so so your exact symptoms depend on the wear and the weak discs and other changes it has caused. Common signs include pain that is in your lower back, buttocks, or upper thighs, which I do have pain in the butt, and I'm not a pain in the butt, but I have pain in the butt. And then on the upper thighs, I have like a really bad like shock, like a big flare shock come through. Anyway, um, it can come and go, but it can be nagging or severe, and it can last from, listen to this, a few days to a few months. Feels worse when you sit and better when you move and walk. I was told that I'm not allowed to walk as much. Um, so it does hurt when I sit more, but if I have a cushioned chair, which I'm in a really soft padded cushion chair, I'm good. If I lay down, I'm okay. But yeah, sitting hurts a little bit. Walking hurts a lot for me. So this is actually some of it's wrong and some of it's correct. So um feels worse when you bend or lift or twist, and that is true. When I bend or lift or even twist my body, it hurts because you're taking your spinal cord, you're twisting it or you're bending it. So gets better when you change positions or lie down. And I do notice when I have my heating pad on at night, or if I have it up here, which I'm gonna get another one here in a couple days. I'm gonna actually have one up here and one downstairs, so I don't have to keep bringing my heating pad upstairs. But I do notice that when I'm laying down and on the heating pad, it helps a lot. So in some cases, DDD can lead to numbness and tingling in your arms and legs. So almost if you are, uh, it's almost like a sign of diabetes neuropathy. It's instead of in the says in the legs and in your arms, diabetes people get in their fingertips and their toes. So and I get weakness in my arms a lot, and I can't move my hands, my arms up more than this. I can reach it all the way out if I'm laying down for some odd reason. But anyway, um, I do get like a tingling sensation, like when like you're getting ready, when you have sat so long that your leg starts to tingle. That that is like a tingling sensation. I also get muscle spasms. Um, This means your damaged disc may be affecting the nerves near your spine. So, how is it diagnosed? So, we've talked about, real quick for the people that are just joining us, we're talking about degenerative disc disease, um, what it causes, what are the symptoms, and now how it's diagnosed. Well, your doctor will talk to you about your medical history and your symptoms. They may ask you, and here's some of the questions that they will ask you: when did the pain start? When did the pain? Which part of your spine hurts? If it has spread to other parts of your body, if you've had past spine injuries, and if you have a family history of similar problems. They'll look at your spine for signs of condition like pain in your lower back or neck. They may also ask you to walk or bend to see which movements can cause pain. Your doctor might order an X-ray or an MRI to check for bone or nerve damage. So an X-ray will check for the bones. The MRI will check for the muscles, um, or I mean for the nerve damage near your spine. So we talked about how it's diagnosed. So how do we treat it? There is no really goal of treatment. Like there is no, I'm done with it. Like be done. No, it's a constant thing that you'll live with for the rest of your life. So the goal is to ease the pain and stop more damage. More damage. Your doctor will suggest the best plan for you based on your symptoms and how serious your condition is. Treatment may include medicine, over the counter pain relievers, um, like aspirin or ibuprofen, can help fight inflammation. They can ease your pain and lessen the swelling. Your doctor may prescribe a stronger drug for pain if you need it. And just don't go in there and be like, hey, Zach, I'm in so much pain. I need drugs. Because don't know. Degenerative disc disease may also lead to muscle spasms. We just talked about that, about me having muscle spasms. So here's what happens. Your doctor may suggest medicine to help relieve them. So, how is it treated? We can do physical therapy, specific movements, make the muscles in your neck and back stronger and is more flexible. This supports the spine. In most cases, physical therapy and pain medications are enough for long-term relief. So, I'm doing physical therapy. I actually have to skip a week because, honestly, this Friday, tomorrow, my fiance has a doctor's appointment. So anyway, but there's also, we just talked about that there is medicine. So physical therapy, and then we can do also medicine. And then the other thing is steroid shots, which I'm never going to do these because I feel like they're just going to hurt really more and they don't last as long. And you only have like a 30-day thing. And I don't have the type of insurance right now that I can do this with. But steroid shots, these have strong medications to ease the pain, the swelling, and the inflammation. Your doctor may suggest that you get a shot in the epidural space in your back, a fluid-filled area around the spinal cord, or to get one in your nerve or muscle. There's also surgery. If other treatments don't work, your doctor may recommend surgery. One procedure is called something. It removes the injured part of your disc, and this helps take the pressure off of your nerves. In some cases, your doctor might remove the whole disc and put an artificial one in. If you have a severe problem, your doctor might permanently connect the bones in your spine after they remove the disc. So that's one paper. Boom. And that only took 18 minutes. Just about 18 minutes. So, that's one. The other one is a lot thinner. Okay? I think it's only got like 3 pages to it, honestly. Yeah, and the other one had like 4. But this one gets more into, what we just talked about. So, you can have neck pain, shoulder blade pain. You can also have muscle weakness, numbness. I'm just going to go through this real quick because we really just discussed everything out of that pamphlet. And that creeps me out now. That looks like an eyeball. Low back pain, which I have. And then how it's diagnosed. We talked about it. We talked about the test. Now, what neither of these papers talk about really is will and can it you paralyze? And yes, it can. I don't know if this one does or not. Talk about I don't think it does. Talk about there's a small chance that if it's keeps going, that you will end up paralyzed. So here's a couple of more little things that you can do. Heat and ice, which we talked about, a heat pad. We talked about doing off and on heat. We're going to talk about heat and ice. So off and on heat and ice. So like 30 minutes of ice and then an hour worth of heat. So that's a cool one. That wasn't in the other one. Yeah, so this one really just talks about really what that first paper did. And honestly, I think my next option is going to be this: to talk to my surgeon on Friday, and see what is going on, and to see what options are best for me at this point. And if we have to spend $10,000 or more or less, less is good. Um, then fine. But they did tell me on the phone Monday. I was diagnosed Monday, and they said, try to walk as much as you can. It will hurt you. It may feel better when you walk, or it may not. And there are going to be days where you feel like you can't walk a whole lot, and that's fine. Don't stress your back out. So I think when I sit, I feel great. Um, I have more problems on my right side because I do more stuff with my right side instead of my left side. So I think I will continue doing physical therapy. It's actually something I'm gonna do after this video, after this live stream, and talk to physical therapy, and even talk to the lady that I normally go with, and talk to her. Um, Possibly doing a treadmill, seeing if that would work, to get these muscles. So, and what they're really doing is basically making me more limber. And I don't do the physical therapy stuff at home, because I am in so much pain the rest of the week. And um, I know I'm not going to see a difference if I don't do this, but they're wanting me doing it like um, 7 days a week. And I can't do that. If I'm sitting in pain like I am now, I'm in the bathtub. I'm, on a heating pad. I'm doing the things I'm supposed to be doing, but I don't know. That's why I want to talk to my surgeon about it on Friday of next week and see what he wants to do. And if we do talk about surgery, there is only a small percentage that that I will survive. And I have questions of like survival ratage and all that stuff. So the survival ratage is probably pretty good. But we'll see. Like I said, we'll see what happens and all that good stuff. So, all right, well, guys, thank you so much for watching. If you liked what you saw, and if you want more of these sit down videos, hit that like button, hit subscribe, and then hit the bell notification to be told when I'm doing another live stream or vice versa. And I'm actually probably going to do another video as soon as I get done talking with the doctor Friday and seeing what is our options. So thank you so much, and God bless.